Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and welcome to our briefing for Thursday, May the 28th. Since our May the 27th press briefing, we have 92 new cases of COVID-19 reported in Montgomery County, which brings us to a total of 6,779. These positive cases are a result of a positive test for the virus, not any tests from the antibody test. 23 of these positives are from long-term care facilities, 9 are from the Montgomery County Correctional Facility, and 60 are from the community. These positive individuals are from 26 municipalities. 61 of 62 Montgomery County municipalities are home to individuals with COVID-19. These individuals range in age from 11 years old to 100 years old. And you can check our county map at montcopa.org/COVID-19 for an updated listing and mapping of the various municipalities. Today we have 40 females and 52 males. 6 are known to be hospitalized, 7 are in isolation at home, and 79 are in other facilities, some in the correctional facility, some in long-term care facilities, and some we don't have information on. I'm also saddened to confirm that 13 more Montgomery County residents have lost their lives to COVID-19, which brings us to 675 deaths confirmed positive from COVID-19. 4 passed away in a hospital, 9 in a long-term care facility or residence, and they ranged in age from 69 years old to 100 years old. Overall, we have had 365 females and 310 males who've lost their lives to COVID-19. Self-reported racial information as we have it: 16 Asian, 3 Asian Indian, 2 Asian Korean, 83 African American or Black, 227 white, and 344 unreported. In terms of probable deaths today, and as a reminder, a probable death is one in which COVID-19 is listed on the death certificate, but we do not have a confirmatory lab test. We have 125 probable deaths. So adding to our confirmed total of 675, that brings us to a total of 800. And as I have mentioned in the past, if we do get confirmation of any of these probable deaths, they are moved into the confirmed positive total. Our hospital beds, we had been seeing a slow but steady reduction in hospitalizations. However, today the number of hospitalized COVID-19 patients is approximately 250, which is an uptick of about 40 patients compared with 3 days ago. So again, just a reminder that this virus is still out there and it is still causing people to become sick enough that they do require hospitalization. 23% of these individuals are requiring a ventilator. We continue to work with 94 long-term care facilities that are reporting positive cases of COVID-19 in their residents or staff. Today we are at a total, and remember this is a cumulative total over time, a total of 1,862 residents and 686 staff that have tested positive for COVID-19, for a total of 2,548 positives. Not all of these individuals are Montgomery County residents, so these numbers are not entirely part of our total, or our official total, but we are continuing to track these cases and want to make sure that people are aware of the situation that continues to be challenging in these facilities. Although I will say that things are continuing to improve and the numbers are going down. And so we are extremely pleased to see the trend going in such a positive direction. In terms of confirmed positive deaths, 566 of the 675 confirmed positive deaths, which is 84% of the total confirmed positive deaths, are individuals from long-term care facilities. I mentioned yesterday that we had made the decision to retest all inmates at the Montgomery County Correctional Facility who had previously tested negative for the coronavirus. We tested 718 inmates on May the 21st. We now have all but 15 of the results back, and we have 92 inmates, or 12.8%, that have tested positive. So that is the same number of positives that I reported yesterday. We did get a few tests back from yesterday to today, but all of those individuals were negative. Currently, all inmates that have tested positive for COVID-19 are stable, and we continue to hope that that is the case. They are in isolation, and their direct contacts are in quarantine, and we hope to keep everyone there as safe as possible. Community testing continues to be readily available. Our Pottstown walk-up community test site is open at our Office of Public Health's Pottstown Health Center at 364 King Street in Pottstown. Testing will be available tomorrow, Friday, from 11 a.m. until 1 p.m. by appointment only. To register for an appointment in Pottstown, you can call 610-970-2937. starting at 8:30 a.m. tomorrow morning. Our Norristown walk-up site is also open and will be open again tomorrow, weather permitting. That site is at the Delaware Valley Community Health Center. Appointments for Norristown can be made tomorrow morning starting at 8:30 by calling 610-592-0680. And our Montgomery County Community College testing site is also open and running smoothly. Thanks to everyone involved there, Whitpain Township, the Township Police Department, of course, the Community College, and the Pennsylvania National Guard, which has just been extraordinary in the assistance that they have given to Montgomery residents. So far, for the dates inclusive of April 16th to May the 23rd, we've tested 7,075 individuals, and we've received results on 6,887 of those individuals, which is 97% of the total. 944 of these individuals have tested positive for the virus. For 32 days of testing, we are running 13% positive. The appointments for tomorrow at the community college site will open up at 8 a.m. tomorrow morning. Appointments can be made at montcopa.org/COVID-19 under the green County Testing Information button, or you can call, also beginning at 8 a.m., 610-631-3000. A reminder that the site at the community college will be open on Saturday, but will be closed on Sunday for a safety stand down. And both Pottstown and Norristown are closed Saturday and Sunday. I also want to remind you that both CVS and Rite Aid are offering no-cost testing at a couple of different locations in Montgomery County to those who are 18 and older. You can see an updated list of locations and get information about how to make an appointment at montcopa.org/COVID-19. First, click on the green County Testing Information button, then click on the testing sites map, and then click on any of the green dots on the map, and a window will pop up that will give you information for that site. So yesterday, I mentioned that the first no-cost food distribution was coming to our county today. This food distribution is being coordinated by the Montgomery County Department of Public Safety, the MACO Anti-Hunger Network, and the Eastern Montgomery County Emergency Management Group in conjunction with Feeding Pennsylvania and Phil Abundance. a number of groups came out to help on this very rainy day to distribute 3,000 boxes to 1,500 cars of people. I want to thank the Abington Township Emergency Management Group, the Abington Township Police, RSVP, the Montgomery County Medical Reserve Corps, and the Montgomery County Animal Rescue Response Team for coming out and volunteering and helping to safely and efficiently distribute this food. This food is being provided by the United States Department of Agriculture Coronavirus Food Assistance Program. And this is a very important program that is buying food from our farmers right here in Pennsylvania and making sure that that food gets to people who need it. So we are so honored and pleased to be a participant in this program. So far, we have a 6-week program with the possibility of renewing for an additional 6 weeks. So we will, of course, say yes to that. It will depend on whether or not the program's available to us. Today, 3,000 boxes of food were distributed, 2 boxes to each car. Every week, the contents of the boxes may be different. Just to give you an idea, today it was mixed dairy and mixed fruits and vegetables. Any food that's not distributed will be sent to our local food banks here in the county, who have, of course, been working overtime, as we have talked about previously. So to learn about where the distribution will be next week, and we will be moving around the county, please go to the Montco Anti-Hunger Network website. That is www.montcoantihunger.org, montcoantihunger.org, and they will be posting information about next week's distribution. So we have a couple of graphs for you today. This first graph you have seen before. This is an update of our graph that shows the individuals in Montgomery County by age who have tested positive for the coronavirus. That's the blue bar graph. And then just beneath it, the individuals who have passed away from the coronavirus, also listed in the same age brackets as the graph above. So you can see that this virus continues to impact all age groups. We show this because I think there was a little bit of a misunderstanding about who was actually getting this virus. So you can see that it is affecting all age groups. And in fact, the 20 to 29-year-olds are almost as impacted as the 40 to 49-year-olds and the 60 to 69-year-olds. However, when it comes to the most serious complication of the coronavirus, which is, of course, death, that definitely is impacting our older citizens, and they are clearly much more likely to, if infected, to suffer serious consequences from this disease. So I share this information with you to remind you that any of us could have this virus, and we all have a role to play in keeping every member of our community safe, because if a younger person gives it to a parent or a grandparent, it could have very, very serious consequences. So that's going to take me to our second graph. And this is a new set of information that we haven't presented before, but we keep very, very close watch on our data. And we saw something happening over the last 2 weeks, which we thought was important and that we wanted to share with you. So this graph shows the overall number of cases has increased by 26% in Montgomery County in the last 2 weeks. And that's represented by the black dashed line. So this is just our overall number of cases. The trend has been going down, but just in absolute numbers, we've seen a 26% increase in the last 2 weeks. Now, what's important about this is that, and this is what I'm sharing with you, is that people under 50 are getting infected at a rate higher than the overall average. That's the red bars. And people over 50, except for that highest age range group all the way on the right, are getting infected at a rate lower than the overall average. So those are the green bars. And then underneath each age bracket, you can see the absolute number of people in each of those age brackets on May the 13th and May the 28th. So for instance, if we look at the 20 to 29-year-old group, you can see that as of May the 28th today, 748 people in the 20 to 29-year-old group have tested positive for the coronavirus from the beginning. This is back from March 7th, compared with the 70 to 79-year-old group, where that number is 720. So again, just trying to remind everyone that we are all at risk, and that as we move into the yellow phase, we have to keep in mind that the yellow phase is a slow opening, that the coronavirus is still in our midst. I believe that we've put the infrastructure into place to move into the yellow phase safely, but the success of this next step will depend on you. We must each take personal responsibility for our actions, and any one of us could have the virus and be contagious, even if we don't have any symptoms. Covering your sneeze or cough, good hand hygiene, keeping your distance, and wearing a mask helps protect you and those around you. And as I had mentioned in the last couple days, we have posted guidance on our hub website. It's a pretty comprehensive guidance. I want to thank Philadelphia County. They've been working with our entire region to help put this guidance together. And we've personalized it and added a few things for Montgomery County. But we urge you to take a look at this guidance. We've made our best efforts to compile lots of different guidance that's out there from the Pennsylvania Department of Health and the CDC. And we hope that you will find this useful as we get closer to moving into the yellow phase. We want to reopen responsibly. So please, please spend some time with that document. And finally today, I want to acknowledge that in just 3.5 months, over 100,000 Americans have lost their lives to COVID-19. It's hard to imagine such a loss in such a short amount of time. This number is bigger than the number of Eagles fans at the Link, which holds 69,176 fans, and more than twice the number of fans at Citizens Bank Park, which holds 43,000. We know that 675 of them were our family, neighbors, or friends here in Montgomery County. And our deepest condolences goes out to all of their loved ones and friends. We owe it to their memory to learn from this rapidly evolving tragedy and make sure their lives were not lost in vain by working together as a community to learn from the data, be open to new information, and pull together to help each other during this incredibly challenging time. Working together as a community is how we beat this virus and honor those whose lives were lost to it. And with that, I will take questions from the press.
This afternoon, we're joined by Jim Melwork from KYW. Jim?
Ready. I thought there was going to be more. Is Ken on or election questions? Or is that...
No, Commissioner Lawrence had a conflict for today, but I'd be happy to try to answer the questions if I can.
I guess you can answer. One of the questions dealing with some other counties, what are the recommendations, requirements, whatever the proper word is, for masks on election day for in-person voting?
We are asking anyone who chooses to vote in person on election day, which is June the 2nd, to please wear a mask. We, however, will not deny someone the right to vote if they don't have a mask on, but for the protection of our poll workers who are there for the entire day and those who you might be in line near, everyone will be socially distant in 6-foot increments. But for the protection of everyone at the site, we ask that everyone wear a mask.
We've heard from some others, county, state officials saying that yellow is generally or could potentially be the quicker phase. Do you have any insight on that or any idea what that might look like, or is that just too kind of hypothetical?
Could you tell me what you mean by quicker phase?
Time-wise, I mean, it potentially won't last as long. We could get through yellow quicker and get to green, or is that too hypothetical?
So if you're asking if it could be a shorter time than the time that we've been in the red phase, I would hope so. I think that that is absolutely possible. It will depend on how the people in Montgomery County respond and if they are willing to put in place the measures to reopen responsibly. And that's why I've been stressing the guidance and stressing the personal responsibility of everyone as we head into this yellow phase. So from my discussions with the Pennsylvania Department of Health, if as we move into the yellow phase, they will be closely monitoring for any disease outbreak or hotspots that seem to crop up in the county. That is why they were very focused on how much hospital space we had available, what our contact tracing capabilities were, what our testing capabilities were. And it's because we've put very robust infrastructure in place around each of those things that they are comfortable, as am I, with us moving to the yellow phase. But the yellow phase is a soft opening, and people will need to continue to practice social distancing, keep their hands, very mindful of their hand hygiene, wear a mask to protect others in case you are someone who has no symptoms but is contagious, and take all of the steps that we've been discussing. If we do that and we do that well, then I'm hoping that we will not be in the yellow phase nearly as long as we've been in the red phase.
And you talked about it a little bit, but the uptick in hospitalization, can you read anything into that, or is that one of these things that doesn't make a trend until it becomes a trend?
Yeah, I don't want to overread into that, but we are, as I share with you, watching these things on a daily basis. And so just to remember what we know about this disease, it seems the pattern is that someone will get sick and often not be that sick for the first 4 or 5 days. And then most people get better at that point, but some people then seem to really take a turn for the worse and often then require hospitalization. And so what we're seeing in hospitalizations today, probably represents activity from maybe 2 to 3 weeks ago, potentially. So I would just say that is when we started to see people spontaneously deciding that it was time to move into the yellow phase and being a little more mobile, maybe taking being a little less mindful of social distancing and some of these other pieces of good advice. And so this is what we're going to have to be dealing with. And when I say that we need to learn to live with this virus, these are the kinds of things I'm talking about. I do believe we'll see an uptick of cases as we move into the yellow phase, but hopefully that uptick will be small and one that we can manage, which is why it's going to take everybody in our community working together to reach that goal. I can't do that by myself.
And I don't remember if playgrounds was a state thing, a municipal thing, or a county thing, but is there any guidance on playgrounds as we move from red to yellow?
Playgrounds will be closed until the green phase, and that's in the governor's guidance.
And then one last quick question about efforts to extend the mail-in deadline. Is there anything new on that?
So as you know, our team filed in the Montgomery County Court of Common Pleas on Tuesday to extend the deadline for receipt of ballots to be the same deadline as those who live overseas or serve in the military have at their disposal, which is 1 week after the election, assuming that ballot is postmarked with or by election day. That was denied. That filing was denied. And so we have immediately appealed to the Commonwealth Court. And I have not gotten an update about where that stands in terms of that court. Mr. Soltesiak, I think you're on. Do you have any more recent update? He may not actually be on. So that's all I have on that.
That's the full update for now. We'll have more to say likely tomorrow.
I'm good.
Okay. Teresa or Todd, anything else?
There's a question from Maggie Kent at 6ABC. Is there any concern that Montgomery County may be delayed beyond June 5th in moving to the yellow reopening phase because of the number of positive COVID-19 cases?
I believe that we are on track to move into the yellow phase on June 5th. And again, it's not just about the numbers of cases, it's about our capacity for testing, which is increasing every week. It is about the overall availability of hospital beds in our region. To put the number I gave you today of 250 into context, at our peak, we had a little over 400 people hospitalized. So we do have capacity in our hospitals. Our contact tracing team is up and running and is now doing close to 50 contact tracings a day, and that number will increase by next week. So we believe the infrastructure is in place to move safely to the yellow. We'll be presenting updated positivity information tomorrow by date of testing. And this is actually very important for our county. The state presents their data by the date that the test is reported, which can often be as much as a week, or in the case of long-term care facilities, sometimes it's 2 weeks or longer before we get all of that information reported. So we are analyzing our data and sharing it together with the state by the date the test was done. We believe that, and it is a much more accurate way of looking at positive cases. And we're going to update that information for tomorrow, but you'll see, for instance, even as of last week, our long-term care facility cases were actually below that 50 per 100,000 number that was part of the governor's original metrics. And our community cases are heading downwards. So even if we're not there by next week, I believe that the infrastructure is in place that we could quickly respond to any outbreaks that crop up, assuming, and this is the big assumption, that everybody in our community follows the social distancing guidelines. If they don't, then we will see a much more rapid increase in positives, and that could set us back. But I am confident that the people in our county understand the importance of this and that they will do what they've been doing for the most part, which is really complying with these guidelines.
Thank you.
Is that it?
That's it.
Okay, great. All right, then we'll see everybody tomorrow. Thank you. Thank you, Rebecca.